There we go.
Hello.
What's up? How you doing?
I'm all right. How are you?
I'm good. Just getting set up here. So, introduce yourself.
My name's Riley, and I'm an ICU nurse. I've been a nurse for 8.5, going on 9 years. ICU has always been my specialty, and yeah, I'm treating COVID patients in the ICU right now. It's pretty intense.
Yeah, I bet. Oh,
Yeah.
we got Karin in the house. Um, so how was today? This is your second time working the COVID unit. Like, well, just tell me what you work. There's different shifts and different sort of responsibilities.
Yeah. So I work in the coronary care unit and the ICU unit, so I get floated between the both of them, and also neuro ICU. Um, but I've been floating to the COVID unit because of the needs of the hospital. So today I was on, and it's completely different from any other ICU unit I've ever worked on.
Hmm.
It's like you walk in, you're just blown away. There's just, it's almost like, it's like an organized chaos. Um, War zone. A lot of my nurse friends are like, they call it like you feel like you're in war.
Hmm.
Just lines everywhere. You have to gown up. You're basically treating patients in a bubble. It's really, it's like
Wait,
Disney.
so wait, do they have it their own floor?
Yeah, yeah,
Multiple floors?
yeah. So there are different acuities, basically like how sick somebody is. So we have different units for patients who are COVID positive or they are pending their COVID tests, and we isolate them in a unit. And so we have kind of like the people who don't need that much care, who are really stable, but we're just keeping them on watch just in case they decline. Um, and then we have the ICU unit where patients go who need to be vented and need a lot more support.
Cool. And so yeah, so then what's the big difference? Like, well, tell people what gowning up, gowning down, doffing, donning,
Yeah,
PPE, like all the terminology.
yeah. So I don't know if a lot of people really remember like Ebola and how, you would see people on the news just like they'd see tents and all that kind of stuff. It's very similar too, and I think the media is kind of portraying it correctly when you see people in the bunny suits. Um, so basically, before you go and enter into a patient's room, you have to, put on the appropriate protective equipment. So you have you have a what we have it's called a PAPR. So since we are low on masks, we're using these kind of like these positive airway with filters that are kind of just pumping air into a mask. Because if you have a whole mask and it has like a cape over it,
Hmm.
you'll basically it's like breathing in into a bag. So it has you've got your airway, and it's like a big mask, and then you put a gown over it, and you have multiple pairs of gloves, and you have to have everything that you need to do in that patient's room with you and ready to go. So and it's a tedious process, but the most tedious process is pretty much like leaving the room because you don't want to contaminate the exterior of the room. So that's why it's really important. There's a lot of, I think a lot of the media is saying, oh, you don't need mask or you do need mask. And you can actually, wear a mask and it would be bad for you. You
Mm.
know, if there's an appropriate way of taking a mask off. And if your hands aren't clean and say you touch something in a grocery store and you don't wash your hands, or you don't have gloves on, and then you go, you're just increasing that risk of chance of like it getting on your face, which is a really big deal. Um, so when you're actually know you're in a COVID positive room, you're very, very careful, and it's very methodical, and it's actually really stressful because you also have like this mask on and all you hear is this pushed air. So
Hmm.
it's like it's a very heightened um, situation when you're in a patient's room, and especially when they're declining. And then you know, you're in there by yourself and you have to communicate with the people on the outside of the window, you know. So we have whiteboards and we're writing on the windows and we're writing on the boards, and we have to communicate with the staff is on the outside if we need something on the inside, or if something's happening, or if you need help, or if the patient's declining and you need the team. There's just so many more steps involved when you take care of one of these patients compared to if it was just a regular patient. You can just enter the room. Yeah, I don't know. It's just a lot more.
That's great. Yeah, yeah. So how many are there people? So like your specific hospital, we won't say exactly which one. It's near downtown LA. It's, you know, down. We're talking about Los Angeles. We're talking about downtown. Are you guys like super overloaded, or are you at capacity? You know, where are you at with capacity?
So with capacity, we can still take patients. So as far as like being in the hospital, our admission rates are down, is because we aren't accepting any new patients. We're not accepting, we don't have any elective surgery. You know, a lot of patients who come to the hospital who need chemotherapies or any of these kind of non-essential, I guess, treatments or surgeries, they've been postponed, canceled, or held. And so the patients that are at the hospital are basically, you know, patients that really do need the care right now. It's, you know. Mm-hmm. And so we have the ability, we're actually, you know, our ICU is overloaded. I'm not going to say that, you know, we don't have space, but we're currently switching our coronary care unit into a COVID unit. So there is a lot of overlap. So our coronary care unit is basically patients who need any kind of heart care. They have a heart attack, they need a stent placement, they're going for open heart surgery, they're there for heart failure. So we're seeing, you know, our admissions there, because a lot of our elective surgeries like pacemakers and such like this are being postponed. And then we're having to make room for the COVID patients once it gets there. And we are starting to see that leak over our ICU to leak over into our other ICU units that have the capacity to take those patients.
Mm. What about other hospitals, you know, in the area or just in our city generally?
I think it's similar. As far as like, you know, I mean, we have plenty of staff, and I've heard that other hospitals are the same. You know, they're actually sending some nurses home, which is is like contrary to what you see on the news, you know? So I don't think staffing is an issue at all as far as taking care of the patients.
And then what have you seen? I mean, you've only worked it twice, but I know our other friend, you know, lost a patient the other day and had to witness it. You know, have you had to do this?
I haven't lost a patient. I mean, I've lost many patients in my career, but not a COVID patient. But she did, you know, share with me her experience. And I mean, when you lose a patient at all, I mean, it's a sad day, you know, it's a loss for everyone, even if you're not personally close to them. But when you watch a patient with COVID, you know, pass away, it's like, you don't know, you know, it's like, you don't know why, and you couldn't do anything more, you know, you just don't know. It's just like such a shock, you know, and it's a total loss, and it's heartbreaking.
Yeah. So the families, how are the staff doing? I know.
So,
yeah.
I'm sorry, continue. What?
No, yeah. I just want to know the general vibe of the staff and how they're handling it.
Well, yeah. I mean, anxiety is really, really high in the hospital. I mean, the air is just full of tension. I mean, you know, a lot of people are resistant to change. And when things happen really fast, and yes, like we try to be as prepared as we could be for this, right? We were given so much time, and we had to prepare for, I don't know, I mean, they really did try to warn us, you know, what we needed. And I feel like my hospital has been doing a great job. The staff we're just scared. I think most of the staff is scared because we want to protect ourselves. and we want to be able to protect our families and the people that we come home to. And there's stuff we don't know about COVID, and when you don't know, that fear just kind of, it really weighs on you. And everybody wants to protect their loved ones. Even us being there, like treating patients one-on-one right there with all these patients with COVID. So I mean, I don't want to get COVID. I'm a healthy young woman, but I'm not nearly as afraid as somebody who has to go home to young children or to their mother that they're taking care of, don't have anywhere to put them. So I think it's just a lot of the fear of it's just what we don't know about COVID, and it'll, everybody gets it. I mean, except for children, but like the old, the young, it's female, male. I mean, it doesn't, it takes all person.
Yeah. Well, we should probably talk about that part because you seem less worried than other people.
Yeah,
And
I'm not so afraid of getting it, honestly. It's just I'm afraid of how inconvenient it's going to be for me to be down for a couple days if I have to call out of work and, do that much. But I'm not too scared of it.
well, it's interesting because it's reassuring that you have this attitude. You've been reassuring me, and I've been trying to, pass along this message. We're at no point trying to downplay this, right? We're not saying that it's not a problem, but I'm just trying to see if there's, someone on the inside that can maybe allay some people's fears. Or I don't want to get too cautious. That's why today I posted about all the people we're seeing that are getting this, right? It's the older people, it's the sick. We know about this, but then the thing is, we're the media is saying, hey, look at all these sick people. Or sorry, look at all these really healthy people that are getting sick. And I don't know if that's true because from what you've told me, it seems like they're not super healthy, and our perception of health is incorrect.
Sure. Yeah, I mean, it really is scary watching the media because, they say, they report, oh, this young teenager, 17 years old, died from it here in LA. And I don't know what, I guess underlying the patient had, some underlying health issues, so we don't, I mean, I'm not going to say that and I can't say this is like a generalization from what I see and when I walk around the clinic and I kind of survey. I can't go into other patients' charts and talk to them, but I do talk to the attending physicians, and I've been talking to them a lot and asking them, what do you think? Like, and these are, I mean, very, very renowned doctors. I mean, they've been at these hospitals attending doctors for years, very respected. And I kind of asked, what is the demographic here? What are we working with? Like, what patients are we seeing with the worst outcomes? Death. And why majority of the patients that are in the ICU, the COVID ICU, like, what do you think is like an underlying factor? And the doctor said, it's normally obese diabetics, like for majority of it, and smokers as well. But all my patients that I've taken care of have all had are diabetic or some kind of metabolic dysfunction. You see a lot of overweight patients, and they don't even have to be obese. Honestly, they're overweight, and you can look at them and say, yeah, those are not healthy patients.
Yeah, but they're not necessarily like taking up the whole bed.
No, absolutely not. But they are um, the patients that I've taken care of and the patients that I can see, a lot of them are overweight and obese. I can say that with confidence.
And
And
then men.
majority of them are male.
Yeah,
I
that's
made
what you said.
that's it. I made that when I was walking around, and I thought, wow, I've only seen a few female patients in the ICU.
Do you think it's just these men of a certain age just don't take care of themselves as well as females do, or do you have any idea?
That could be it. That could be it. I'm not sure, but there's also, you know, uh, we in nursing, when you're obese or when you're that overweight, you carry a lot of weight in your chest, and you're literally too big to breathe on
Mm.
your the effort to breathe when you have extra weight on your chest, and you have to be sedated, because when you are on a vent, you have to properly be sedated or asleep. A lot of people think, they give you medications to put you asleep so we can have better control of your respiratory system and drive and everything functioning, respiratory wise. But if you have that extra weight, it's so much harder to get to deliver the amount
Yeah.
of oxygen, and it's so much harder for a patient once you've already become weak and deconditioned and been on a vent. You're weak and you're tired and you can't take a deep breath. You can't because you're so
Hmm.
weak. You have that extra weight, and it's so hard for that tissue to expand and deliver oxygen to your body, which is so important when you have any kind of infection, and especially a lung infection. It's like, and you get pneumonia. It's so hard to get that oxygen delivered to your body.
Yeah. So people who've never smoked, people who do some exercise, and they're not carrying a bunch of weight around them, and they can breathe pretty well. But still, we're still seeing some of these people get it supposedly.
Yeah,
I
we
put out
are.
this yeah, I put out this poll today because I wanted to see. Some people thought I was trying to downplay it and be like, "Oh, no one's getting this." I'm like, "No, that's not what I'm trying to do. I want to see." There was two things. I wanted to get people to send in stories like, no, I know someone who's
Yeah.
22 and they are on the soccer team. And I didn't really get that. I mean, 95% of the people, you just turn your camera.
Sorry.
95%, the polls, they both ended at 95% about on Twitter and Instagram that they don't know personally anyone who was healthy that got sick. But that doesn't mean that that's the case, right? I polled
You're
a
always
certain audience.
right? You're always going to have your outliers, but
Yeah.
majority of these patients are overweight, diabetic, ex-smokers, and they're just not healthy people, right? And I just think in general, you know, people who are unhealthy, or they have a harder time recovering from anything,
Hmm.
you know, whether it's a broken leg, or I don't know, a common cold or anything like that. I have family members who are smokers and they get a cold and they end up in the hospital with pneumonia, you know?
Yeah, sounds like the same kind of thing. Yeah.
Yeah, I'm not saying that COVID isn't dangerous, and we should, and what we're doing is, everything that we're doing as far as the social distancing and protecting, the elderly population or the people who are most at risk. That's super important. Um, but I think it's really important to reflect on all of it, and kind of like think like, wow, well, if this is happening now, it could happen again, at a larger scale, and I think, people should definitely take their health more seriously, especially with all the
Yeah.
media. I don't know.
Yeah, I think that's the big takeaway, and a lot of people in our little health community are talking about that this is kind of a wake up call, and
Yeah.
that hopefully it doesn't just pass and the media just makes their own narrative, and whatever that may be. We want to get the narrative out there that everyone should wake up,
Yeah.
stop smoking, focus on your health. If the next happens again, be ready.
Yeah.
Anything, even if it's not COVID, just like you
Oh,
said, like
yeah.
any kind of sickness that could come along, it
Yeah.
could get people. So here, Daniel, my man from Toronto, asked if you've seen any healthy people. I know your sample size is small. What is your
Yeah.
sample size, even that you didn't treat personally,
Yeah.
that you've seen around the hospital walking around? And then,
With COVID.
yeah, what's the
Oh,
sample
yeah.
size, and how many of them were probably sick or were sick beforehand?
Well, I have friends who have had COVID. Like, I know that they've had COVID.
Mm-hmm.
And they're young. They're in their 30s, and they basically just said that, you know, it was just cold-like symptoms. They had
Mm-hmm.
a nasty fever. They had to sweat it out. They couldn't break the fever, and it was a bummer for a couple days, but they feel fine now.
Mm-hmm.
you know there was one friend of mine who's a smoker, and he's in his 30s, And he reached out to me because I'm a nurse, and when you're a nurse, everybody reaches out to you.
Hmm.
But you know, I told him, you know, just be careful if you start feeling short of breath. I mean, go to the hospital and check yourself in. But I do want to say, you know, we have patients who go home all the time, every day with COVID after healing from COVID. So this isn't like a death sentence. It really isn't. ICU, as far as the percentage of people compare, you know, positive COVID patients, you know, that I don't know what the right now, at least what the numbers are, what percentage of that actually end up in the ICU, but it's not nearly as much as the people who test positive and go home.
Mm.
So, you know, and that's the other thing. I feel like people have this huge fear that that's what is going to end up, you know, for them or their loved ones, that they're going to be in the ICU. I mean, it's a possibility, but a lot of people are going home and recovering from this.
Yeah. So it's the same thing. It's the opposite. And people told me these stories in the comment sections too. That like I know someone who isn't healthy. They eat a bad diet, and then they got it for a couple days, and that was it.
Yeah.
So there's not like huge common things that we could just say we know how this works. But the one thing that I want to just talk about more is the our standard of health is so low. You know,
Yeah.
there's the classic 88% of people are metabolically unwell in America,
Yeah.
and that if we keep classifying these people as normal and healthy, like, oh man, this is the guy's a pillar of health, so healthy. So I'll talk about some of the specific things people sent me. I got stuff from all over the world, right? All these people, I was been DMing people. It's not all in the comments, and yeah, there was a guy. I think it was in Australia. The worst. It sounded like I've gotten two people that seemed actually healthy that got a severe case.
Mm.
So out of however many people saw it, they're in the sample size is small and it's a selective audience. But there were two people that sounded pretty healthy. You know, the guy's like, I know this guy. He's a doctor. He he played sports. He was
Yeah.
40 something, and he's severe. And there's another person in the comments that they said healthy, but
Yeah.
still. But I don't. What I wanted to know too is are they actually in the health world? There's a difference between healthy
Sure.
and okay. I think there's three levels. There's what people think like they don't have a overt disease,
Yeah.
right? But they're like obese. But they never got diagnosed with
Yeah.
diabetes.
Sure.
So and they could have a million things wrong with them. Then there's people who are healthy, but they, have like visceral fat. They have like this kind of little pooch. They're not actually healthy in my book. And
Yeah.
then the third category is actually healthy,
Yeah.
which I hold to a high standard. And
Sure.
these are people who actively avoid all processed fast food. They don't eat sugar, refined grains, and vegetable oils. I mean, that's a whole different level because the two people that I've heard of that, quote, were healthy and people actually knew them, they're like, oh, well, they didn't know about it. They just ate whatever, right? They're just like, I'm 40 and I just eat whatever comes my way, but I happen to be pretty thin. So
Yeah.
I don't know. What do you think?
I mean, I think that's a really great way to think about it. I mean, I think that's pretty true. But as far as it comes to the patients that I see on COVID, I can't really,
You can't make, yeah, you
no,
don't have,
I can't say, oh yeah, but I mean, honestly, the patients that I see on a daily basis in the hospital in general are unhealthy. I mean, that's where I work. That's my, I do have my occasional patient that has like a random, I don't know, congenital defect, then they need some kind of, heart procedure that needs to be done. But yeah, I think a lot of them are in the first two categories. I rarely see healthy patients, and especially being on the coronary care unit as well. Majority of the patients are there because of their unhealthy lifestyles. I can say that almost in the 90 percentage, majority of my patients are there because of their diet and their health and their lifestyle.
mm-hmm.
And some of them look thin. Some of them look thin. They have like a little bit of extra fat around their abdomen, like you said, like the visceral fat. But then you see them and they're thin and they're pre-diabetic. but they don't look like they should be a diabetic, you know, or you talk to them about their diet, and they've been living this way their whole entire life. Like maybe they haven't gained a whole bunch of weight like some people, but uh,
Yeah.
I think it's very true.
Well,
I
that's
rarely see I rarely see the really healthy people in the hospital. So,
yeah, yeah. Well, and here, Dr. Matt's here, my friend,
oh,
that
cool.
that's talking about. Well, we're talking about two different things. So, for one, we're not trying to say that no healthy people can get it, but we're saying
Yeah.
that these healthy people don't end up in the hospital, and that's what Dr. Matt wrote. Is that I do know other people, and I actually kind of forgot that I personally know a couple of people who got it,
Yeah.
but they they actually got tested, so we know they were positive, so it's not we know they got it, but it was like a couple weeks, it was like a week and a half, whatever. They they didn't feel good, but that was it. And so yes, so a lot of numbers are skewed because these people aren't even going to the hospital. We're not even tracking them. There's all kind of things going on there. So in general, I don't think we're never going to know like every single detail of all the different situations that people have. But just what I'm trying to gather is, are there healthy people that are having the severe conditions? And Matt, I don't know if maybe I can go live with Matt tomorrow, but just I want to know, like, there's a person who's about my age who lives right next to me who got it, but they bounce back pretty easily.
Sure.
Yeah.
I mean, I think that's fair to say. I mean, honestly, if you're actually a real healthy human, your immune system is going to act such and healthy, and you'll get through something like this. We have a couple outliers at the hospital that are young. We have a really young patient in their 20s. I don't know anything about the case, but they're not going to be in the ICU anymore. They're getting transferred. So they're going to a step down unit. They'll be home hopefully by the end of the week.
So we should wrap it up soon, but I want to know what's working. Like everyone wants to know. I think I saw a question a long time ago about, what treatments are working. I'm sure a lot of people have heard about the zithromycin and like chloroquine and
Chloroquine, yeah. We are using that at the hospital.
Yeah.
As far as what's working, honestly, in the ICU, it's time. Like we see these patients and they are on the vents for 5 days, 7 days, and then we finally get them off. It's just time. It's just to see how the body actually responds. And, the more comorbidities you have, the more things potentially can go wrong. If you have a bad heart and you really can't handle a lot of this, but I just think it's time at this point because you just really have to ride out an infection and see how the body responds.
Mm-hmm. And then I guess some closing words was just to iterate that you have made me feel better about this. I don't know if I don't want to get complacent and just be out there like trying to go like have a bonfire with 20 people and hang out. But what from your perspective, what are you kind of, what's your vibe? Like what is your message to people?
I'm really calm about the whole situation, and I think it's just my nature, and I think it's a lot of people in the medical field, their nature to just, we have to just wait this out. But I think the social distancing is very important. Having good hand hygiene. I think wearing a mask, if you know how to wear it appropriately, will help prevent you from touching your face, which is really important. But I also think it's really, for me, I think it's important because we're doing a great job. I mean, as much as we see in the media and how horrible this is all, getting shoved in your face, it looks so horrible, but I see it in a totally different light. I see it as us, just coming together and really, at least at my hospital, we're all working as a team to help all these patients that we need to help. And just think, more people are leaving the hospital and going home. Mm-hmm. Way more people than we are seeing deaths. We see, we extubated a patient on my unit today, and the guy was doing great, and he, minutes later he wanted to watch TV. So, mm-hmm. You have these we have so much success and we see a lot of people going home, and I don't want people to get discouraged about the deaths. And I mean, they're horrible and a loss is horrible, but you have to think about how much we're doing for patients and how many patients we're getting home.
Yeah, yeah. That's the message I'm getting, and that I don't know on a big level if it's more chaotic, but it seems like when I talk to people on an individual basis, that everyone's doing a good job. The hospital management is all, doing a good job. Everyone's staying safe, staying sane. So that's good to hear. And yeah, well, yeah, thank you for doing what you do, and that's awesome.
And everybody should definitely get outside and get sunshine. I think that's like one of the most important things.
Oh yeah, vitamin D.
Yeah.
That's my important thing. I'm going to talk about vitamin D like every episode of the podcast. Uh,
Yeah.
that's the one thing I've been doing every day. Is I found this grass strip near my house that there's plenty of room to socially distance myself and lie down and get some sun, and then I walk home, and it's great.
Yeah, and just have an attitude of gratitude, you know?
Yeah. All right. Well, stay positive, and thank you so much. And maybe we'll check in again.
Yeah. Cool.
Okay. See ya.
Bye.